Professor Alaster Yoxhall. I am a Professor of Packaging Ergonomics. You might think, what's that got to do with hospitals and hospital facilitation and all that sort of management? I was involved in a project a number of years ago looking at packaging and packaging use in hospitals and that sort of thing, and looking at how people were unable to open packaging on wards. In actual fact, we did a project where a third of the staff couldn't actually open the packaging that they were actually supposed to give to patients. And particularly for those patients that are malnourished, one of the NHS doesn't particularly buy lots of food packaging, which is my general expertise, but where it does, it buys it for people who are malnourished and then gives them packaging that they can't actually open. So that was what we were sort of looking at. And what I've been asked to look at today is in a kind of an extension of that, if we're thinking about packaging and tableware and food service and those sort of things. I've been asked to look at reusable packaging, okay? And think about that and look at the barriers to reusable packaging. So that's what we're going to do on a little journey for the next quarter of an hour or so. So you're probably familiar with all these sort of statistics. I was looking around for this when I was preparing this presentation, Innovate UK. So Innovate UK pays my wages, some of the time anyway. Okay, so they're the people who fund research in the UK. And obviously they're very keen to get rid of single-use plastics. There are research streams around that. And if we look at what the NHS is one of the biggest users of single-use plastics in Europe, okay? And you probably know all that because you've been told to get rid of single-use plastics. Otherwise, I wouldn't be talking about reusable plastic systems, would I? And okay, and it's complicated. You've just seen that in another presentation, okay? So it's a complex set of things. It's not just food, which is actually my general expertise. Okay, some medicines and stuff like that, but it's also clinical waste and all sorts of other things that you might use and so on and so forth. But it's a lot, and it's a lot of stuff, and it's a lot of plastic, and there is a desire, as there is outside of hospitals and hospital facilities management in your own daily lives, to remove sort of plastic out of our lives in some way, isn't there? And be, if we like, more sustainable. This is the challenge, though. If sustainable packaging was easy, and I say sustainable reusable packaging was easy, then supermarkets would be full of them, wouldn't they? And they're not. All right? The retail environment is not full of reusable packaging. And there's a reason for that, because it's hard. Okay? Reusable packaging is not straightforward. For retailers, one of the big things, and actually I say for retailers, it is a problem for yourselves as well, but they're subtly different, is this idea of brand ownership. Okay? So they don't like the idea of loss of brand. So if I have my reusable jug, okay, and it's, I don't know, let's say it's McVitie's biscuits, actually. Let's pick McVitie's biscuits. I've got a tin, I go to the supermarket, I put Nestle biscuits in it instead, and then I'm around my house and I'm handing a tin of McVitie's biscuits to somebody, and somebody thinks they're McVitie's, but they're actually Nestle biscuits and they don't like them, we've got a problem. And one of the big, massive barriers to reusable packaging in a general sense is this idea of brand and brand ownership and loss of brand. Okay, against certain items, which you might not have necessarily, fortunately, in a hospital environment. So that's a bit of a win. But it's a real problem in a retail environment to actually create an economics that works, that brands will actually trust. There are ways around it. It gets complicated, though. And we'll see that. And this is the problem. So, to give an example of where it does work and it kind of different approaches to reusable packaging. Beer. Okay, I like beer. I look like I like beer as well, don't I? That is the truth. This is cake as well, by the way, and biscuits, because I've just given an example of biscuits. That's the truth. Northern Europe, most of Europe, beer bottles is all the same. They got together and they went, we're going to make all the beer bottles exactly the same. They're going to look the same. They're going to be the same size. You can wash them. You can reuse them. That's reusability. That's what we're going to do. Beer, and you just put a different label on it. Fabulous. That's not the case with water. The water industry, bottled water, has gone down a different path and says that's not sustainable, that's not sustainability, that's not how you do sustainability. How you do sustainability is you create recyclable PET. So you'll have heard this thing, you may have seen it around, all this idea that this, your Ribena bottle is 100% recycled, rPET. Okay, and this thing has come through the waste industry, rPET. It's been the big solution within the sort of packaging industry is recycled polyethylene. Okay, so but we've got two different solutions to nominally the same problem. One side saying, no, recycle it, that's the better way. This is the most sustainable way. And there are reasons, and I'll come to them, why there are these complexities. But here it says, marketing, retailers, the cultural environment, the legislation environment, which will affect you. It's a big deal, the way in which it's set up, the regulatory framework for these things. And again, how easy it is to brand. We see with bottled water, or even bottled pop, Coca-Cola doesn't want the same bottle and the same bottle shape as Fanta. They're made by different people, and they use their bottle shapes as marketing or ways of doing it. It stops this ability for standardization, which is a barrier to being reused. So, and obviously for you guys, it's not straightforward anyway, because if you're going to, in a hospital environment and we want reusable packaging, you've got to wash the packaging, you've got to store it somewhere, you've got to do all these other things to it. Space is at a premium, I'm sure. It costs money to have that space, And then that kit has to be maintained, it has to be cleaned, it has to be looked after in some way, okay? Because this stuff has to come back and be washed, has to go somewhere, okay? And we've seen from the other presentation earlier that what happens is, what we can see emerging when we're talking about reusable packaging is, I'm an academic, so I can use sort of academic phrases, a socio-technical system, darlings. Okay, so the point is that it's a technical thing where people are inside a technical system, and things go wrong when people are inside technical systems, as we've alluded to. It takes a lot of control. It takes loads of A3 paper prints round a wall to get people to behave in that socio-technical system how you want them to. And this becomes a big problem for reusable packaging, okay? Because we're inside. Hospitals are complex socio-technical systems, okay? And food service and those sort of things, or waste management, is one part of them. There are companies that will do that for you, though. That's the good news, okay? Emerging as part of this trend are people who will provide the machinery for you, do the washing for you, do it all for you. So there, okay, and they will do it. Do an example, and they will do the barriers. So I was approached when I was told that I was doing this, and it became known that I was approached by these people, Colliebox. I don't know if anybody's worked or heard of Colliebox. They're doing some work with Hampshire Trust down Hampshire, Winchester and Basingstoke hospitals, I believe it is. Had a look around. They're doing some work. So Colliebox is a reusable packaging system, okay? And they've been trialling this out and doing this out in hospital and collecting feedback. I've seen some of the feedback, and there are good things about it, and there are things where they've found problems that staff have had to deal with and most of it. But it exists, it's doable. They are a third-party system. They can provide you with third-party packaging for, let's say, I don't know, catering or whatever it might be. So you effectively rent the box, okay? You rent the cup, yeah? It's a bit like, we think about this, you may have seen car sharing ideas and things like that. Well, the idea is that you effectively rent a bowl and a cup, okay? And it gets washed, and it gets reused, and it reused and reused. Now, there are problems with that, and we'll come to that in a second, but that's the idea, and here they are. Very often, people find reusable packaging inconvenient. It is not as easy. I've had 2 cups of tea here today, and I drank them, and I put them in the bin. That's all I had to do. Does that make sense? Doing anything other than that is actually hard work. We just talked about socio-technical systems. What about, people get nervous about the fact that what if I haven't got a refill, or there's nothing for me to be able to use it with, I don't have it, it's not there, I can't do it. It's not free, or it certainly isn't at the moment. Does that make sense? People pay a nominal. Now you can, sometimes people were reluctant, and this is some of the findings from that study I talked to you about. It is available online, by the way, in Colliebox, I think. The people were reluctant to put an upfront cost to it until they know what they were doing. You know what I mean? They didn't know the advantages. Communication and bad pricing, that's what I've said. So communicating, people need to know how this stuff works. Okay, if you're doing something new, we all get a bit nervous sometimes, don't we, about doing something new and all the rest of it. So you need help. And bad pricing, if it doesn't work for people, because on the next slide I'm going to say, I put this sentence here, the feel-good factor is not enough. There's loads of research out there to show that everybody will tell you they're a green consumer. Everybody will tell you. Nobody in here is going to say, do you know what, Alaster, I don't care. Right? But the reality is that we know in the packaging world and the food retailing world that I sort of live in, that when you put the green pack against the cheap pack, it's the cheap pack that gets bought every time. Okay? That is the truth of it. And not everybody is as green as they say they are. So people do actually just put that in any old bin and all those things. That's the truth. It's not that people are bad actors. They're not evil. They're just people. Okay? And the feel-good factor is not enough to make people, oh, we're doing something great. It doesn't just work like that. They need more. They need help. They need assistance. They need guidance. Again, one of the findings from the Colliebox thing was saying on the dispensing kiosks, more information would help with people if we're going to do this thing. I'll just check out what I've been talking. Fab. So, you might think it's complex, and I said you're complex, but in many ways you're not as complex as a retailer, because your brands, if you like, if you think of your brand, particularly if you're doing food service delivery, it's actually concentrated on one sort of thing, isn't it? So you've not necessarily got that complexity. A supermarket might have, a large one might have 40,000 different items in it. You're not trying to deal with create 40,000 different reusable systems in some way. So there is an advantage there. But, and we saw this, I like this, dispersed responsibility was the phrase that I put. We saw this earlier in your conversation about ownership of something. Who owns the fact that we want to do reusable packaging? And we've got these complex, I work for a university, God only knows, we know about complex management structures and whatever else, you know, so getting effective change can be difficult. Okay. But that's it. You've got a controlled environment. You are not in the wild like retail, fortunately. So you can do those things, and it gives an advantage to managing waste, which is what we were talking about. You have waste managers in your sites. So that is a thing to be able to do. And low-hanging fruit, I mean, this is the thing. We think of the low-hanging fruit is your bottles, is those things. There is an effective waste recycling stream already there, really, for those things. Does that make sense? That's there. It's the more difficult things that might be around food service, say, or around single-use packaging, or things that don't even exist at the moment. Because when I was watching your presentation, I started thinking about, because academic, started thinking about research. Oh, has anybody done any research into reusable clinical packaging? How would you make that? How would you make it antimicrobial? You know, my brain starts doing those sorts of things. So, you know, so there is a chance there for you. But it is complicated for the next step of things. So you might have to have what we might call a hybrid model. And I want to talk about circularity because it's important in case you don't know what we're trying to do here. This is the Ellen McCarthy model of circularity, okay? It's about bringing things back. That's what we're trying to do. We're trying to create circular economies. That's what we're doing all the time. This side's the technical side, this side's the biological side. And what Ella's saying, what we're trying to do with reusable packaging is keep the smallest loop. And if you can do the smallest loop, that's the thing. But, you know, that's cool. But it's really, really hard to do, okay? And this side is the biological side. So everything on it. So this side has ground up glass. If we recycle it, it's glass, it's metals, it's your plastics. This side is things where people have been doing for a long time, starch-based things. People have been trying to create starch-based packaging or whatever it may be, plant-based, PLA, things like that, plant-based polymers, these sorts of things. Around this side of things, where they're reusable, biodegradable, and so on. And what we're actually trying to do, as I say, is minimize these loops. So here we have this idea of sharing. What we're doing effectively with our reusable packaging is sharing it. There is a problem though, because actually, if we're not careful, what we actually do is make the problem worse. Because we end up recycling our sharing thing after not enough times. So if you go to Colibox, it says you can use it 400 times. And then, you know, but is 400 times before you recycle that thing a heavier thing with all the infrastructure, with all the kiosks and everything, a more sustainable solution than a throwaway plate? And this is the careful and difficult thing. So we have to think of it in the round and the whole. So we said fight the battles worth winning. You know, there's already things there for soft drinks, dairy products. And so working with people. My colleague said, can you compost things and all the rest of it? You might have that on site and all these sort of things. I want to show some case studies though, because this elevates the point. This is Recup. Okay, Recup. The reason I wanted to show this is in the UK, Burger King tried to launch reusable packaging and it was a failure. It was in 2022, I think, and it was a failure. It lasted 3 months. Lasted 3 months because it was just more complicated. In Germany, they waited, and what they do is they use Recup, because Recup is it's everywhere, so you don't have to take it back to Burger King. So if you think about it, you're using something that is ubiquitous in fast food chains. So you just take it back to another fast food chain. Okay. So it gives you need scale. We talked about Colibox. It's a good idea here. There it is, there it exists, but there were challenges for them. Okay. So in terms of pricing, in terms of ease of use, those sorts of things. So if we're not going around the green side, the blue side, we can go down, for well-designed systems, we can go down the green side, and vegware and things like that with biodegradable stuff and compostable things, if we can do that, if we've got those facilities. People, I talked about people being difficult and socio-technical systems. People generally have got better at knowing what to put where with some guidance. And the good news is that we've got better at telling them what to do. So we now have standard symbols for recycling and things. That exists now. It didn't used to. You should be able to make it up. Okay, that's not how it works. So, to get into the end, Greta Thunberg, there she is. The thing is, and this is the key thing, the message I want to get over to you guys, is it really, really, really depends what you're trying to measure here. Because I said before I came on stage, before I was talking to the colleagues here, and I said, we were talking about sustainability. And the reality is, from a packaging point of view, the most sustainable way to serve any of you some pop, some Coke, or whatever it might be, okay, is still in a litre plastic bottle. That is the most CO2 friendly way of serving you that thing. And you might be going, well, what about? And it's because the weight of glass, the fact that you don't reuse it enough times, People say use a glass milk bottle, use those things, but unless that milk bottle is used a lot and a lot and a lot of times, it is not more CO2 friendly. So when I looked at some of the initiatives that I saw online and various trusts and things like that about reducing plastic waste, the packaging expert and sustainability expert in me goes, be very careful what you wish for, because you're not necessarily reducing CO2, but it might not be CO2 you're trying to reduce. If you're trying to reduce plastic waste, then well done. If you're trying to reduce CO2, maybe not. So we have to be very, very careful about what we're trying to measure. And just lastly, as we get it, so the thing is that we say that true sustainability is understanding that socio-technical system. So it is in effect 3 spheres, yeah. So social side, economic, you measure the money, we know that, we're going to hear a bit more about that. We measure the environmental, and we can, through models, measure how people operate within that system. But if we don't get it right, you end up creating more waste. Okay? And that is it. Reusable packaging can have benefits, but we've got to get it right. Okay? Thank you.